Hello guys, welcome back to my YouTube channel. Let's learn about antipsychotics and the action of those drugs. Before prescribing drugs for psychosis, we have to know the basis of psychosis. So there are four main dopamine pathways which causes symptoms of schizophrenia. The first pathway is Mesolimbic pathway. The Mesolimbic pathway causes it increases the dopamine levels and causing positive symptoms in schizophrenia. Then the second one is Mesocortical pathway, where there is hypoactivity of dopamine and causing negative and cognitive and affective symptoms of schizophrenia. Then there are nigrostriatal pathway and tuberohypophyseal pathway. As you can see in this diagram, antipsychotic drugs act on three pathways: the mesolimbic system, nigrostriatal pathway, and tuberoinfundibular pathway. When antipsychotic drugs act on mesolimbic pathway, it causes psychological effects, sedation, and impaired performance. When the antipsychotic drugs act on nigrostriatal pathway in the basal ganglia, it causes extrapyramidal side effects like Parkinsonism, akathisia, dystonia, tardive dyskinesia. And also when they act on tuberoinfundibular pathway, that means on pituitary gland, causing increased prolactin levels, it causes several endocrine side effects like gynecomastia, galactorrhea, menstrual irregularities, impotence, and weight gain. All those actions occurs via dopamine receptors by blocking the dopamine receptors. Antipsychotic drugs have another three actions, that means it also act on muscarinic receptors by blocking those receptors, alpha adrenergic receptors by blocking those alpha adrenergic receptors, and also antipsychotic drugs blocks histamine and serotonin receptors as well. Let's see what are the effects which causes by blocking those receptors. The muscarinic receptor blocking action of antipsychotic drugs causes dry mouth, blurred vision, and constipation. Alpha adrenergic receptor blocking action of antipsychotic drugs causes postural hypotension and hypothermia. And also the histamine and serotonin receptor blocking action of antipsychotic drugs causes sedation. So those are the side effects of antipsychotic drugs: the dry mouth, blurred vision, constipation, then postural hypotension, hypothermia, and sedation are the side effects. And also there are other side effects as extrapyramidal side effects like Parkinsonism, akathisia, dystonia, tardive dyskinesia, and the endocrine side effects like gynecomastia, galactorrhea, menstrual irregularities, impotence, and weight gain. You can remember all the actions of antipsychotic drugs from this chart. It is easier to summarize the antipsychotic drug action. Antipsychotic drugs are classified into two groups as typical antipsychotics and atypical antipsychotics. The action of typical antipsychotics are the D2 receptor antagonism, and in the atypical antipsychotics, the main action is 5-HT2 receptor antagonism. And also atypical antipsychotics have weak D2 antagonism as well. Typical antipsychotics have high extrapyramidal side effects and hyperprolactinemia due to strong D2 receptor blockade, while atypical antipsychotics have less extrapyramidal side effects and hyperprolactinemia action due to weak D2 receptor blockade. Let's see some examples for typical antipsychotics and atypical antipsychotics. For typical antipsychotics, there are chlorpromazine, pipotiazine, perizazine, perfenazine, and fluphenazine. For atypical antipsychotics, there are clozapine, risperidone, olanzapine, quetiapine. Those are some examples. So that's all about antipsychotic drugs and their action. Thank you for watching.